Well, my last video I titled, Is God Trans? So if you want to listen to that video, click on it. This video, I want to talk more about um, testosterone, the effects, and um, the um, and bottom surgery. I'm not on any testosterone as of yet, but I, but some of the what happens on testosterone is when you take testosterone, your voice deepens, you start growing facial hair, the fat redistributes around your body, and you and if you haven't gotten acne before, you could get acne while you're on testosterone. Now, I've had acne before, and I've seen it wasn't bad acne. It was just like little blackheads here and there, a few zits, but other than that, I'm not sure how bad my acne will act up because you get more greasy with being on testosterone, and your smell gets different where you smell more like more musty. And my understanding that the BO smell gets um pretty strong. um I don't have that much body odor because, well, I don't have that much body hair to begin with. Everybody else in my family is like hairy beasts. I'm not. I don't I don't pluck my eyebrows. They're just naturally like this. Um I don't have much armpit hair. I don't have much hair on my legs. Um like my brothers and my dad have hair on their backs, hair on their chests and stuff, but because they have testosterone, they're guys. Um my mom my mom and my sister have more pit hair than I do. Um so genetically, I'm not as hairy as everybody else, which is I kind of like. But when I'm on T, I know I'm going to get more hair growth. I just don't know how much hair growth. Probably a lot more than I'm getting now. Um, Also with testosterone, your I'm good. Sorry, I'm using a trigger word. Your clitoris or clit grows. It grows out from the clitoral hood and gets bigger. It gets longer and gets a little girthier, and that's basically what they use for bottom surgery, for, in particular, metotoiplasty. Um, I'll get into that in a minute. Um, and there are some side effects from testosterone. Um, Weight gain is one of them. So you want to keep your weight down. I'm currently losing weight so I can get on testosterone. Um, and I'm on Weight Watchers, and so far I've lost 9 pounds. I started at 244 and I'm now at 235. And I've already started to notice some changes. Like, I haven't really noticed any changes in my stomach, but um, okay, here's my stomach. Well, it doesn't protrude out as much as it did, but here's my stomach. Down here is like my pooch. Um, and down here it's harder to lose weight. But with those 9 pounds, it doesn't stick out as much as it used to, which is which is great because that's the hardest part for me on my body where to lose weight is there. Um, and I and you know I'm I've lost 9 pounds, so I've lost a little bit there, so it doesn't protrude out as much as it used to, which was a couple of months ago. So it's and that's a nice change to see. Um, you're also you if you've had any heart related um like any cardiac history, if it's you, or if your dad says had say has had a heart attack, or your grandparents or whatever, then you might have a little bit of a high risk of heart problems. um with me, I was born with 3 holes in my heart when I was a baby, and I had them fixed when I was 7 months old, and I've had no problems since then. So um so I have no issue with um with my heart. And so we'll just see. My dad has had a heart attack, and he had a stent put in, and um and um so I'm gonna have to keep that in mind and be, and my grandmother, my dad's mom, had a stroke towards the end of her life. Um so it's so there's kind of a high risk for stroke in that respect. Um and some people say that testosterone causes cancer. It doesn't, from my understanding. Um, you can get cancer from on like other parts of your body, like say bone cancer, um, or kidney, or stomach, or liver, or um, lung, throat. You can get cancer, but it all depends on if you might be at a higher risk if somebody in your family has had cancer, like my grandfather, my dad's dad. He he had cancer towards the end of his life, and they thought it was lung cancer, so they opened him up, and it turned out the cancer wasn't in his lung, it was in the lining of his chest. So there was nothing they could do but sew him back up. And 2 months from his diagnosis, he passed away. So, of course, he was around radiation a lot because he worked on, he didn't work on the atom bomb, I don't think. But he was in the Air Force, and he worked on stuff that was like that, I think, but I'm not exactly sure. Anyways, um, so you could get cancer, but testosterone doesn't cause you to get cancer. Um, some of the pros on being on testosterone: you get to live your life the way you want to live. Like, I want to sound like a guy. Um, I probably won't grow anymore because, well, I'm 37 and a half years old, and I'm 5'4" and 3/4", and I'm probably not going to grow anymore because you grow during puberty, and my puberty's been over for years. So, you know, what are you going to do? Also, some of the pros is Um, oh, actually, um, with lower surgery, like with metotoiplasty, I'm not going to talk about phalloplasty. I'm going to talk about metotoiplasty. Is they use the growth you grow, and you have to be on testosterone for at least 2 years to get the maximum amount of growth you're going to get. Now, usually bottom growth happens. Sometimes with certain people, it never happens. And that's just what your body does. If you get bottom growth, great. If you don't, that sucks, but that's just how your body reacts with testosterone. I personally hope my body, that I grow bottom growth, because if I didn't, that would suck major. And then I would have to, if I wanted bottom surgery, I would probably have to go with phalloplasty, and I would rather not. Um, they use what you grow, and um, they, if you want, you can have your urethra lengthened so you can stand to pee. They usually do a vaginectomy where they close up your vagina. Another trigger word. They close up your vagina. They close up your hole, basically. And they also do scrotoplasty if that's what you want. Now, you don't need to have a vaginectomy. You don't need to have scrotoplasty. You don't need to have a Mons reduction. You don't even need to have urethral lengthening if you don't want it. If you don't want bottom surgery, don't get it. It's your choice. But for me personally, I want bottom surgery. I want metotoiplasty. And I want urethral lengthening, a vaginectomy, scrotoplasty, and I hope to get it all done in one surgery. Um, so I only have to heal up one time, and I don't care if my penis is small. I don't care if it's small. I don't care. I'd rather have something there and balls instead of nothing at all. Like currently, I have nothing at all there because I'm not on testosterone yet. So, um, I have thought about, I've talked about this in other videos, but um, um, that I've thought about getting like a testosterone booster. Since I'm not on estradiol, I'm on not on any estrogen whatsoever, and and I've had a full hysterectomy. I've had everything removed, including my ovaries and everything. Um, that I that I thought about getting a testosterone booster, like Nugenix or something like that. But I think about that, but at the same time, I want to do it medically and safely. I want to try and do that safely. So some days I want to get that testosterone booster, and just get things started. But other days I'm like, no, I want to do it the right way. I want to do it safely. Be on test I want to be on testosterone under the care of a doctor, and go go from there. But today's one of those days where I'm thinking I want to get things started right away. But that's just today. And probably tomorrow I'll be thinking, no, I'm going to do it the safe way and do it, you know, do it with a doctor and stuff like that, you know. But today is one of those days where I'm like, yeah, I want to get it started. I want to get that started. But it's just what I'm thinking. Maybe I will touch on phalloplasty a little bit in this video. Okay, now with phalloplasty, they take it from, they take skin from either your forearm, which is RFF, which is radial forearm flap, which they take a nerve um, and skin from your arm to create the phallus. And they can also take it from your leg. That's called ALT. I'm not sure what that stands for, but they use your leg. If you use your leg, then you can, it'll be girthier, it'll be more round, a little more girthier. And they can do urethral lengthening, vaginectomy if you want that, scrotoplasty if you want that, penile implant if you want that, and they usually do that in stages. It depends on which surgeon you go to. Like, I know Dr. Chen does like phalloplasty, urethral lengthening, vaginectomy, scrotoplasty, but I think you get your testicles in stage 2. I'm thinking in a different stage, but they make the scrotum in stage 1. Stage 2, I think they do the testicular implants, I'm thinking, but I could be wrong. Stage 3 is usually if you want a penile implant, like an erectile device, then they usually do that in stage 3. But with phalloplasty, there are a much higher risk of complications, and personally, I'm just not comfortable with that. I've thought about it, but I'm like, you know what? There could be so many complications that, you could get a stricture, or basically your urethra narrows, or it could close up completely. And that would be awful, meaning you couldn't pee. And that means you would have to have like a subpubic catheter in for months and months and months, possibly, just to pee. Or you'd have to come in for a revision and they would have to open it up and put in a new catheter and all that stuff. You could get a fistula, which is like a little hole in the urethra. And you could get, and sometimes they heal on their own, sometimes they don't, and you need to have a little revision to fix it. For me, the rate of complications is just too risky, too great for me to feel comfortable doing that. So, that's why I'm more comfortable with metoiplasty. Yeah, there are complications where you could get a stricture or you could get a fistula or whatever, but a little revision and you're set. So anyways, that's basically what goes on when you're on testosterone. And and if you're wondering, if you're wondering, after you've gone through female puberty and your body changed, your bone structure changed because of the shape of your body, your bone shape doesn't change. The fat redistributes, but your bone shape doesn't change. So anyways, that's basically it for this video, and I will talk to you guys later. Bye.